Veronica McNally, we now welcome Alicia Stillman, the founder of the Emily Stillman Foundation. She's also the co-founder of the Meningitis B Action Project. And Emily, thank you for joining us today. I want you to start out and just tell our listeners why you started the foundation.
So I started the Emily Stillman Foundation after I lost my 19-year-old completely healthy daughter to meningitis B in 2013. She was a college student, a sophomore at the Kalamazoo College, and she called home one night with a headache. And I thought she was overtired. I thought she was coming down with the flu. She thought she was overtired. And we decided she would take Motrin and we would talk in the morning. During the night, she was taken to the hospital, and it turns out within 30 hours, she was brain dead. My daughter had been vaccinated with the vaccine we used in the United States at that time, and still do, the Men-ACWY vaccine. But in 2013, the Men-B vaccine was not yet licensed in the United States. So it was not available to protect my daughter, but it is now.
So there are two types of vaccines. Can you talk a little bit about those two vaccines?
Yes. So there is one vaccine. It is a quadrivalent vaccine. It can be referred to as the quadrivalent, the Men-ACWY vaccine, and it protects against serogroups A, C, W, and Y. Until 2014, we did not have a vaccine licensed to protect against serogroup B. Serogroup B is responsible for all college outbreaks in the United States since 2011. It's responsible for over 50% of the cases among adolescents and young adults in the United States. So in the United States now, in order to be completely protected against all preventable strains of meningococcal disease, the young adults and young people must be responsible to get the Men-ACWY vaccine and a Men-B vaccine. The Men-ACWY vaccine is given at age 11 with a booster dose at 16 or 17. The Men-B vaccine can be given at age 16 to 23. There are two different manufacturers. They're both two-dose series.
So, Veronica, now I understand why you felt so strongly about making sure that this message gets out to our listeners. Take it from here, Veronica.
I think that the first thing I want to talk about is how sorry I am for Alicia's loss. I continue to hear the story, and every time when I hear it, my heart breaks because you just should never have had to go through this. So please know that my heart is just continuing to ache for you. When parents go into the provider office and they talk about the meningitis vaccine, can you elaborate on when else they might want to be considering this? In other words, is camp somewhere that they might want to be thinking about it? And if they're traveling and they're just a little bit older, should they be thinking about the meningitis B vaccine?
So my opinion is absolutely. But we're having a hard enough time getting our providers to routinely talk about the Men-B vaccine within the age groups of the recommendation to begin with. So my opinion, if I had a child going to camp, if I had a child involved in sports and close contact, absolutely. But right now, the recommendation for ACWY is that they will be vaccinated at these particular intervals. And for Men B, the recommendation is May. And that's really a key word that is creating a huge barrier for coverage. And it is a shared clinical decision to be made between a provider and a patient and their parent. And that is creating so much misunderstanding that is an additional barrier. So there's so many barriers that we're facing and we work with within our organization to achieve coverage within the 16 to 23-year-old age group as it is. My hope and dream is we get comprehensive coverage among all age groups.
And I think it's really important for parents to hear that, because, you know, we go into the provider office with our children and there's a lot we don't know, right? We were not experts and trained in this information. And so, Alicia, what resources do you provide to parents to educate them about this meningitis B vaccine?
So the Meningitis B Action Project has fabulous resources that are utilized around the country in provider offices, on college campuses, in medical systems, all over the country. There are posters, there are videos, there are brochures addressed to the young people to start to take charge of their own health care, as well as to the parents. And we strongly recommend using those resources to educate themselves, because many people don't know to ask the questions. Many parents don't know to ask the question. Yeah. So when my daughter contracted Men B, there wasn't the vaccine available that could have protected her. However, there is now, but young people are still dying because they don't know. And education is key. You know, we're creating an inequitable situation. We're creating a situation of knowledge and knowledge nots. And in the United States of America in 2021, that's just not okay. Everybody needs to be aware. Everybody needs to have access to this vaccine.
And you mentioned that there's two different manufacturers. Can you talk about how the manufacturer doses are not interchangeable? In other words, patients who get the first dose from one manufacturer need to get that second dose from the same manufacturer.
That's completely correct. They work differently. So GSK makes one called Bexsero, and the protocol is you get your first vaccine and then the second vaccine is 30 days later. And Pfizer makes one called Trumemba, and on that one it is a 6-month interval. And yes, whichever one you start with, you need to complete. And in addition to that, it's very important because the protocol has not yet been determined. If there is an outbreak on a college campus and they may want a booster dose at that point, it's very possible that you will need the same one you started with, so you're not starting fresh. So that knowledge and those records really need to be kept up to date, and in a school system with a parent, they need to have awareness of which vaccine they received.
So, Alicia, why aren't the providers doing more with regard to this?
So the Meningitis B Action Project did a study on that to find out why. We know they're not, because there was a study that was published in Pediatrics. We know they're not in the majority of cases, or a large volume of cases. We know that they are not. So we wanted to know why. So the reasons that we determined were either they're not thinking it's important enough if it's not recommended at the university. It is not a common disease, and that they don't understand the ACIP recommendations. They don't understand it. So what is a shared clinical decision? And so they don't bring it up. But I've even been told, look, I have X amount of time when I walk into a provider room to talk about the vaccines that have a 100% recommendation. I don't have time to talk about the optional vaccines. And I just look at them and I say, optional. My daughter's life wasn't optional.
No. Alicia Stillman, founder of the Emily Stillman Foundation and the co-founder of the Meningitis B Action Project. Thank you for sharing your story.
Thank you for having me.
It is really admirable what you are doing. Just a wonderful public service for our listeners. So we really appreciate it.
Thank you.
You've been listening to Why I Vaccinate, presented by the Franny Strong Foundation and the Michigan Department of Health and Human Services. I'm Ann Thomas, and on behalf of my co-host, Veronica McNally, thank you for listening, and we hope you have a great day.